Leptospirosis is a serious infectious disease that poses a significant threat to both humans and animals. It affects a wide range of species, including domestic pets and livestock, making it a concern for both public health and veterinary care. Caused by Leptospirobacteria, it thrives in warm, moist environments, particularly in tropical and subtropical regions. Common carriers include rodents, cattle, and pigs, which can spread the bacteria through their urine. Infection occurs through direct or indirect contact with contaminated water or soil, often during activities like swimming, farming, or during floods. Leptospira enter the body through cuts, abrasions, or mucous membranes, such as the eyes, nose, or mouth. Symptoms range from mild flu-like illness, such as fever, headache, and muscle pain, to severe complications like kidney failure, liver damage, and even meningitis. Early diagnosis and treatment with antibiotics are crucial to prevent severe health outcomes and reduce the risk of long-term complications. However, symptoms often mimic other diseases, making diagnosis challenging and sometimes delaying appropriate treatment. Accurate diagnosis relies heavily on laboratory testing, including blood tests and cultures, to identify the presence of Leptospirobacteria. Accurate diagnosis of leptospirosis is essential for effective treatment. Laboratory testing confirms the presence of Leptospira. Proper sample collection ensures reliable test results. Contaminated or improperly collected samples can lead to false results, affecting patient care. Healthcare professionals must follow strict guidelines for sample collection and handling. Diagnosing leptospirosis relies on appropriate sample collection, which is crucial for accurate results. Blood samples are typically collected during the first week of illness, when the bacteria are most likely to be present in the bloodstream. Urine samples, on the other hand, are collected after the first week, as the bacteria may be excreted in the urine at this stage. In some cases, tissue biopsies may be necessary, especially if there is suspected organ involvement, to provide a more comprehensive diagnosis. Blood tests are used to detect antibodies or the presence of bacteria, providing critical information for diagnosis. Urine tests help identify bacteria through microscopic examination or culture, offering another method to confirm the infection. Tissue samples are meticulously examined for bacteria or signs of tissue damage, which can indicate the extent of the infection. The choice of sample type depends on the patient's symptoms and the duration of the illness, ensuring the most effective diagnostic approach. Collecting blood samples for leptospirosis testing requires precision and attention to detail. Gather all necessary equipment, ensuring everything is sterile, and label tubes accurately. Apply a tourniquet to the patient's arm, cleanse the area thoroughly with antiseptic, and draw blood carefully using a syringe. Release the tourniquet gently and apply gauze with pressure to stop any bleeding. Invert the tubes several times to mix the blood with any additives. Dispose of needles safely in a sharps container. Transport the samples to the laboratory promptly to ensure they remain viable for testing. If there is any delay, store the samples at refrigerated temperatures to preserve their integrity. Following these meticulous steps ensures that the test results are accurate and reliable. Collecting urine and tissue samples is crucial for diagnosing leptospirosis. Instruct the patient to clean their genital area. Collect a midstream sample to minimize contamination. Transport samples promptly or store refrigerated. Collected by a qualified professional. Place in a sterile container with preservative. Transport immediately or store refrigerated. Proper labeling of all samples is crucial for accurate identification.